Hello and welcome to Let's Share. I'm Molly Dasobre. This episode we will be talking about the things that make sexual and reproductive health services truly friendly for the adolescents and the young people. And we want to find out what they are comfortable with, why they want to access a healthcare facility when they are in need, and what would make them keep going to that particular healthcare service anytime they have a pressing issue. Joining us to have this discussion is Gilbert Ashanti. He is the project lead for SHARE and also the programs manager for WaterAid Ghana's Health and Wash Aim. Thank you very much for joining us today.
Thank you.
To the layman understanding, what is youth-friendly corners?
Great. So youth-friendly corners, as people will call it, youth-friendly centers, they are special places within our healthcare facilities where is dedicated for provision of services for adolescents. And these places have specially trained nurses that are friendly to the youth. And so we call it youth-friendly because, the environment, the people that are working within this space have been trained such that they welcome the youth, they understand the youth, they understand their issues, and they know how to provide services for young people when they come. And so we target like youth, or we target as youth friendliness. There's also what we call the youth responsiveness. The youth responsive service delivery is where everybody within the healthcare facility is trained in youth friendliness. So that everybody, whether a nurse, whether a doctor, whether a midwife, a cleaner, all of them are trained, have the capacity to accept and work with young people. So that when they come, they would know how to handle them.
Oh, okay. I see. That is quite understandable. What are the characteristics of a good or that makes a healthcare youth-friendly for the adolescents?
For instance, if you pick like a corner, a youth corner or a youth center, the Ghana Health Service has a clear-cut policy as to what are some of the things that should go in the youth center or a youth corner that makes it a place. The first one, as I mentioned, the first one I'm talking about is the capacity that you need to give to the health workers. It comes with a whole model of training that you have to give to the health worker who will be working with this adolescent or who will be working in that facility. And so capacity building is one thing that you need to give. And I have always said that you should not think that every health worker can provide youth-friendly services. And so once they have been trained and they have gone through the nursing training, of course they are trained there, but there are special training that we take them through. Again, the resources and the equipment that you need in a particular facility to make it youth-friendly. Youth like games, right?
Yeah.
They like games. And so one of the things that we fit the facilities with is games. So they come there, they play games, all kinds of games and all that. And then during that process, they have issues and they can engage the health worker who is stationed at the facility. There are those people that we call youth facilitators. Those youth facilitators are like leaders who would be at the facility where the games are and all those things are to ensure that young people that are coming there are monitored, are guided. When they have issues, where do they go? When they have redresses and all those things, where they should go. And even when it comes to counseling, they begin the counseling process with the adolescent, and then the adolescent, the facilitator can refer to the professional. There are some of the issues, they are minor issues that through peer education, youth facilitation, they are able to pick them up and then share with them. But those that are beyond them, then they refer them.
Okay.
Again, a youth-friendly corner must have something like a television. They also want to watch movies, cartoons, they want to watch other things. And through that, they learn. And there are specific models of reproductive health that we take them through. Like assertiveness, can have a short video on assertiveness, short training on assertiveness, on reproductive health, like family planning issues. So there are series, life skills, and all other issues. So usually you see a television there. Now we, as part of this project, we are bringing additional things to add. Of course, we are piloting it to see how it will be so that we can engage Ghana Health Service. We are looking at access to water, access to sanitation, access to changing rooms, access to proper waste management within these areas, coupled with the standard that Ghana Health Service has kept in place, so that at the end of the day, we would be able to get these children, preventing infections when they come to the facility, and making sure that they get adequate services that they require.
Okay, so with the interventions that are being made by SHARE, what can you share a few success stories on how these has been implemented?
Thank you very much. So the SHARE project is ongoing. There are so many things that are still in plans, but some of them has been done. So for instance, if you pick the health workers, we've built capacity of health workers in menstrual health and hygiene, in youth friendliness. Now, one of the things that we want to do is the infrastructure. So when it comes to the capacity aspect, we have done a lot. We've worked with RTP, Right to Play. We've worked with FHI 360. We've worked with other organizations, other partners that we are working with to build a lot of capacity. Youth friendliness, youth responsiveness, and all that. We've trained the capacity. Now, what we are going to do also is the infrastructure aspect. So currently, we are going through a procurement process where we are going to put up 8 youth centers, youth-friendly centers in the Upper East region. In our 4 districts, each district would have 2 centers fitted with all the standard wash infrastructure, menstrual health infrastructure. They will have their bed for screening. They will have a chair, a table for the midwife that will be there. They will have a television. They will have all kinds of games. They will have screens and everything that is provided on the policy to make sure that the youth corner or the youth center is standard as we want to see by the policy. We want to do that because we want it also to be a model for the country, so that at least, anybody around the country at any corner of the country can come and see how it is and also go and replicate same. There has been projects that has, done youth corners, youth centers over the years, and some are still doing it. But we want to add the touch of the wash and make it special, where you'll be incinerating your waste, menstrual hygiene waste, and all those things. We'll make sure that all these things are available to support the young people. And so for SHARE, we are hoping that by the end of this fiscal year, and when I say fiscal year, it ends in March. Our project fiscal year ends in March. We would be able to finish with the construction work so that the nurses that we have trained can start working, so that young people can also come to this facility for services.
Okay, Gilbert, now I would want to find out, how can we ensure that the sustainability of these interventions are done properly once SHARE is done?
Great. So we have started sustainability right from beginning of the project. Because, you are investing money, you are investing resources. And the question is, if I leave, who will take care of these things? Who will maintain these things? And so we have several approaches to make sure that we are sustaining. The first thing that we are doing is that, for instance, when it comes to the incinerators we are putting, we have a team that we have trained, even though the incinerator is not in yet, but we have trained a team that will be managing the incinerator. So we have what we call facility management teams that have been trained, and their work, and they include a chief from the community, a community political member, so like a assembly member or a unit committee member, somebody from the healthcare facility is part. We have a youth or an adolescent being part of this community, this group, and then we have community members. So in each community where we are going to do these things, we have trained the facility management team. Now, when we finish the construction of the youth corner, we would also have a facility management team in terms of who is managing the water that we are providing for them and making sure that there is a flow so that the water doesn't break down and you go to the facility and you don't have access to water. So WSMTs are also going to be trained there and making sure that they take care of our water resources or the water facilities that will provide the water for the facility. So we have all this in place. And then again, we have another approach we are using to target the district health facility, district health directorate, and then the district assembly. Because whatever facility that we provide will be left for the district health directorate and the district assembly. So we are using the life cycle costing approach again here to make sure that the cost for the project, the maintenance of it, as part of their budget. And one approach we are using on this project is that we are tracking how much they are costing and how much they are releasing. There's a difference between costing it in your budget and releasing it. They can cost it and do not release it. So we are tracking it every year to see how much they have costed for maintenance and how much they have released for maintenance. So we believe that by the end of the project, by that 5 years, it will become a norm routinely that when they are budgeting, they will budget and make sure that they release those monies to support with the maintenance. I know that we don't have money as a country, but some of these things, if we sustain it, I know it will go a long way to reduce the teenage pregnancy rate that we have in this country to help us as a country.
Now back to the health sector. How do we ensure that the healthcare workers are providing the necessary and better need with conditions to these young people on sexual reproductive health services?
Great. We've talked about capacity building. So we have built the capacity. But I think one of them is attitude, right? Changing attitude towards these young people. Seeing them that they also have rights to service delivery. And so when they come in, we need to welcome them, listen to them. Some of them, they are coming not because they want medicine. Some of them, they are coming not because they want family planning. Some of them are coming because they need advice. Some of them are coming because they need counseling. They are confused about certain things. And so when they come and you have time for them and you talk to them and you explain things to them, you would realize that they would understand themselves and then would have the right information to take decisions for themselves. And so I would want to implore our health workers to be open, especially those that have been trained and those that have the capacity, to be open and be willing to accept them. Take them as your kids. If you have a kid and the kid is walking into you to access services, we shouldn't intimidate them at all. So with the required capacity, I'm sure they would be able to do that. And one of the challenges that Ghana Health Service and these health workers were facing were facilities. Like I said, we are providing some of the facilities. It is not going to be for all the communities where we are working in. And so we know that some of the communities, definitely the challenge of the infrastructure will be there. But what we want to urge them is that you have the knowledge. And that's what we we call improvisation. Young people would want to come to the facility after your all daily routine services that you have provided. They would want to come in the evening. Can you create a corner? Can you create a session? Can you create a place within your facility and dedicate it for them? And they will come. So even though the policy says you need all those things, but if they are not there, the little that we have, what can we do so that we receive them? I know these young people are our future, right? So it is important that we do whatever we can do possible to make sure that we are reaching out to them so that they get the required services, they get the required information to be able to take good decisions to help them grow, to become like us, to become like the nurses and those people that we expect them to be, that responsible people. And by that, they would also support us economically. Because when they work, they pay taxes to the economy. And so yes, we are living in a challenging environment, but let's try our best as health workers and see what we can do to support these young people also.
If you're an adolescent out there and you need any information on your sexual reproductive health, do not hesitate to contact She Plus hotline on 0800 001 122 or any of the numbers on your screen. Thank you. How can we make sexual reproductive health services more accessible to young people? Leave your answers in the comment section. Thank you very much, Mr. Gilbert. And that's it for this episode. Don't forget, this has been Let's Share. I am Molly Dasobre. Bye. Hello, we have finally come to the end of Season 1 for Let's Share. It's been exciting. For the past 13 weeks, we've had a lot of discussions. We've given you the in-depth of the SHARE project. We have spoken about teenage pregnancy. We have spoken about reproductive health services. We've touched a little on the youth-friendly corners. And we want you all to follow us on all our social media platforms where we'll continue the discussions on all these issues surrounding the youth and the adolescent. Don't forget, this has been Let's Share Season 1, and I have been your host, Molly Dasobre. See you in Season 2. Bye.